Healthcare in Canada is renowned around the world for being publicly funded, accessible, and equitable. Yet more Canadians than ever are turning to private healthcare. Why? What's driving this shift? And what are the shocking reasons behind it? In this video, we'll explore the surprising truth behind why some Canadians are stepping outside the public system and into private healthcare. Stay tuned, what you discover may shock you. And if you're new here, make sure to hit that subscribe button and give us a like if you're ready to learn more. Canada's universal healthcare system, Medicare, has been a cornerstone of Canadian identity since its inception in the 1960s. The promise? Free access to essential medical services for everyone. But in recent years, an increasing number of Canadians have found themselves waiting longer and longer for care. According to a 2023 report by the Fraser Institute, patients are waiting an average of 27.4 weeks between seeing a general practitioner and receiving treatment from a specialist. This long wait time is one of the main reasons some Canadians are looking elsewhere. Private healthcare offers a faster alternative. Meet Sarah, a Toronto resident. After experiencing severe knee pain, a doctor referred her to a specialist, but the earliest appointment was 6 months away. Sarah was left frustrated, in pain, and uncertain about her condition. That's when she decided to pay out of pocket for private care. I was desperate. I couldn't work, I couldn't sleep properly, and the public system had me waiting indefinitely. I felt I had no choice. Private healthcare in Canada isn't as widely known or accessible as it is in countries like the United States. While it's a smaller sector, it's growing rapidly. Private clinics offer faster access to diagnostic services, surgeries, and specialist consultations, allowing patients to bypass the long wait times in the public system. But faster access comes at a cost, both financially and ethically. Private healthcare fills a gap where the public system falls short, especially with regard to wait times. However, it raises critical questions about equity. Those who can afford it may get quicker treatment, while those who can't are left waiting. This creates a two-tiered healthcare system, which many Canadians oppose because it undermines the principles of universal access. So, why are Canadians choosing private healthcare despite these concerns? The first shocking reason is the fear of delayed diagnosis. For conditions like cancer, heart disease, or neurological disorders, time is of the essence. A delayed diagnosis could mean the difference between life and death. In a public system strained by increasing demand and limited resources, some patients, particularly those facing potentially life-threatening illnesses, are unwilling to take that risk. The second shocking reason: elective surgeries. Many Canadians are waiting over a year for non-emergency surgeries, such as hip replacements, knee surgeries, or cataract procedures. But in a private clinic, these procedures can be performed within weeks. For patients like Sarah, who need immediate care to maintain their quality of life, the decision is clear. But this raises a critical question: what happens to the patients who can't afford private care? Does private healthcare create a divide that undermines Canada's commitment to fairness and equality? There's no doubt that private healthcare creates a two-tier system. On one hand, it offers relief for those who can afford it. On the other hand, it can exacerbate the inequities already present in our healthcare system. The risk is that the public system becomes even more strained as resources are diverted to private clinics. If wealthy patients exit the public system, there may be less pressure on the government to address the underlying issues of wait times and funding. The third shocking reason: overcrowding and understaffing in public hospitals. As demand for healthcare services continues to rise, public hospitals are struggling to cope. Emergency rooms are often filled to capacity, and overworked staff are stretched thin. In a private setting, the experience is often drastically different. Patients can expect more personalized care, shorter wait times, and less stress. But again, this level of care comes at a cost. For many, private healthcare isn't an option they want, it's an option they feel forced into. So, what does the future hold? As private healthcare continues to expand, the debate about its role in Canada's healthcare landscape grows louder. Some argue that a blend of public and private care could offer the best of both worlds: faster access for those who need it, while still maintaining a robust public system for all Canadians. Whether you agree with private healthcare or not, one thing is clear: Canadians are turning to it because they feel they have no other choice. But at what cost? Does this shift signal the beginning of a larger healthcare divide in Canada? We want to hear your thoughts. Drop a comment below and let us know where you stand on this issue. And if you found this video insightful, don't forget to hit the like button, subscribe to our channel, and ring the bell for more thought-provoking content. Thank you for watching, and stay informed.